Yeah, thanks, Carrie and Maria. Before I jump in too far, I'll just give you a quick background on who CCHI is. So we were started in 2000. We are a membership-based nonprofit, nonpartisan advocacy organization that really works to improve healthcare for consumers. And really the focus of our work lately has really focused on improving equity and affordability for consumers. And when we were started in 2000 and really continuing to today, and Carrie, you can jump to the next slide. We were started to be a bit more of a umbrella voice for consumers. There are a lot of consumer advocacy groups, but some are focused in a particular disease area or population specific. We try to bring all of those voices together. And so we are by nature a coalition-based organization. And we regularly stand up sort of additional coalitions for particular focus areas as needed. And we were also largely started to try to make sure that consumer voices were represented in a lot of the health policy decisions that were being made. Next slide. Just really quickly, because this does relate to some of what I'm going to present quickly, is we have sort of three main program areas. We have a consumer assistance program, which is what I'm going to focus on mostly today, that provides direct assistance to Coloradans who are dealing with medical billing issues. We have very robust policy expertise in the healthcare space, particularly as it relates to Medicaid and private insurance. And so we do a lot of work, particularly at the state legislative and regulatory levels. We do some work at the federal level as well, when appropriate. And then we also have a robust sort of outreach and engagement program that includes a lot of communications, a lot of outreach and training for Coloradans, as well as a sort of direct field organizing program that we added recently. Next slide. All of those programs really feed together to focus our work. But as I said, I'm going to focus on our consumer assistance program today, which we started in June of 2018 to help Coloradans navigate some of those tricky healthcare billing issues and insurance challenges that can come up. So a lot of the issues that our consumer assistance team tends to help folks navigate include surprise medical bills. So when they get a balance bill from an out-of-network provider that was unexpected, that they didn't know was part of their care team, those should hypothetically be diminishing substantially, which I'll talk a little bit more in a moment about. We also help folks navigate insurance claim denials or potentially prior authorization issues that they're running into. We have access to a database of prescription drug assistance programs and discount programs that we can help folks access. It's certainly not perfect, and it doesn't touch all drugs. So it is sort of depends on what's available. We also help a lot of consumers access hospital financial assistance. So charity care that may be provided to them based on their income through hospitals. And then there's a very large other issues category because there are so many things that unfortunately can go wrong in the healthcare billing, insurance, and access space. So we work one-on-one through this program to advocate with clients or for them with insurers, hospitals, and providers as needed. And since June of 2018, with a staff of 2 to 3 people and a very small cadre of excellent volunteers, we've saved consumers $4.3 million. We've resolved over 1,600 cases in 45 counties throughout the state and have a very high satisfaction rate for the folks that we have provided this service to. To sort of connect this to some of the shop for care and sort of the all payer claims database a little bit more overall, a lot of the issues that we work on legislatively are directly come through our consumer assistance program and the issues that we see consumers grappling with and are helping them try to resolve. I listed here one issue that was pre-consumer assistance program, and that really is tied to sort of a rapid growth of freestanding emergency rooms in Colorado that started really around 2015 and expanded quite rapidly over the next few years after that. That was helped along by some of the APCD data. There is an old, sort of older now, snapshot of what those freestanding emergency room costs looked like throughout the state and how quickly that expansion was happening. We also led the efforts here at the state level to tamp down on surprise out-of-network billing protections in 2019, and those essentially protected consumers from all surprise medical bills if they had a state-regulated plan. With the Federal No Surprises Act that started on January 1st, that expands it to a lot of essentially all other insurance plans, but the federally regulated insurance plans. And that was a primary issue that we were grappling with through our consumer assistance program, and unfortunately continue to do so. We also passed the Health Insurance Affordability Enterprise in 2020, which starts to create some additional financial assistance because we are still hearing from a lot of consumers through the cap that even if they have insurance, they were having trouble affording access to care. And also there are still a number of populations that can't access financial assistance through the Affordable Care Act, namely people who fall in the family glitch or people living without documentation or have DACA status. And this gives us a tool to start providing some assistance to those folks. A lot of big bills passed this last session in 2021. One that sort of flew under the radar, but was very much informed by our consumer assistance program, are some revisions to billing requirements for indigent patients, primarily in hospitals, but it also touches on provider services as well in hospitals. And this is because some of the charity care laws that we worked to pass in 2012 and 2014 were not being implemented consistently in the state. And there were many people who we were having to help through the consumer assistance program access hospital financial assistance when they should have been screened already. So this helps ensure that they are being screened and if eligible are able to access that kind of assistance. We also passed the Prescription Drug Affordability Board, which we worked with Civic and the Department of Healthcare Policy and Finance to get a variety of data pieces around to make sure that we were informing that policy as best we can. And ultimately, I think the board, as it begins its work this spring, will be relying significantly on a lot of the APCD data and the prescription drug costs that people face. And then, of course, the much highlighted in the media last year, the Colorado option legislation. We worked in a variety of ways to think through, okay, based on consumer experiences and how we know people, particularly who struggle with health disparities, how they struggle to access care, we were trying to structure standardized plans that insurers would offer that help improve equity and help address some of those access concerns while also starting to reduce costs and control them going forward. Next slide. Just to give you a quick overview of some of the issues we are seeing a little more recently through the CAP, facility fees, which is not necessarily a new issue. It's sort of a perennial issue that we see crop up through our consumer assistance program. And even prior to our consumer assistance program starting, it was a really common issue that consumers reached out to us about. But what we have seen that is a bit new is we're seeing more cases where facility fees are being charged for routine outpatient care when a provider is or their facility is owned or very closely affiliated with a hospital. And that is really concerning because somebody can walk in for a copay oriented or even potentially a copay free service and walk out with hundreds of dollars in facility fees. We also see a lot of challenges that consumers run into, and this is where the Shop for Care tool can come into play, at least for the procedures that it's available on, is oftentimes consumers, especially if they are uninsured or underinsured, they will try to get estimates of a procedure before they go through with it. And oftentimes we are finding that those estimates are wildly different from what is billed, even if there aren't extenuating circumstances that happened in the procedure. And so there are some cases where we are able to use some of the shop for care data to push back in some of those billing circumstances, or our consumers that we're working with are able to do that. But it's an ongoing challenge. The surprise bills that I already mentioned, we are still getting a lot of cases from those federally regulated plans that the protections only began on as of January 1st. And there's one little loophole in state law for publicly funded ambulances that are still allowed to send consumers balance and surprise bills. And we have seen a number, not a huge number, but a decent number of cases related to those. And then, as I mentioned, a lot of help to consumers accessing hospital financial assistance and making sure that they're screened properly. We've seen a few cases where folks have had an adverse reaction to the COVID vaccine. And then because they oftentimes have a high deductible plan, are left with thousands of dollars in medical bills. There are hypothetically programs from the federal level that help with that, but they're really hard to access. Also, surgical care for uninsured patients is very difficult to access because often at times surgeons will not even schedule something if somebody doesn't have coverage. And then perennially, people who have already landed in medical debt that's in collections, which is really hard to unwind. There are a few instances where we're able to do so, but it's tough. Next slide. I will mention very briefly that our consumer assistance program has seen a pretty significant surge in cases since November, and that has very much stretched our capacity. We're not entirely sure why that is happening. It might be because more people are becoming aware of the surprise billing protections, or some of those surprise bills are coming to fruition before the protections go into effect. But ultimately, we don't have a great explanation on that. This has coincided also with one or two of our staff transitioning to other opportunities and some of our volunteers moving on to different things as well. We're working to create some more website resources and some self-help guides for consumers to navigate some of these issues, but we have had to implement a bit more of a triage approach to cases. Next slide. That's the information that folks can use to access our consumer assistance program. And I'll jump quickly to the next slide. There are a variety of ways that folks can get involved in the work that we're doing. We always have a variety of ways that folks can take action on our website. If you have a particular medical bill or story that you want to share as it relates to medical care, please reach out to us. You can also volunteer with our consumer assistance program or some of our other outreach efforts. And you can donate to support our work, or even sponsor our consumer assistance program if that's of interest. And I will leave it there.
Thank you so much, Adam. Lots of information in a short amount of time. Thank you. Amazing work that you guys are doing, and I really appreciate everything that you are providing to consumers. I wouldn't know where to turn, even though I've been in healthcare for a long time. It's hard to navigate. So what the work you guys do is just amazing to really provide that direct one-on-one support. So yes, if you need to reach out to Adam, his information's here. We will have all these slides available. Maria did have a question for you related to, are you seeing cases increasing for accessing mental health services?
We have seen some cases through our consumer assistance program for accessing mental health services. Those have often related to people who are uninsured in general. I think we do hear challenges from folks who are insured as well, just because they're having trouble finding a provider to get an appointment with and really be seen for the care that they need.